this morning, we tried to frame that this sector is struggling to keep pace with the bad guys, and that it's getting a little bit worse, and that there's some competing philosophies. Hopefully you've seen that we're trying to paint that everyone's trying to act in good faith and solve these hard problems, but that we're gonna need a bigger boat. So a lot of this morning was reminding us that through Nate's talk, we had to look at resilience, not just confidentiality data. Through Mark's, we looked at this is an all hazards thing, not just a cyber working group kind of a thing. We know some of the stakes are the closures of rural hospitals or delayed, degraded, denied patient care that can affect outcomes and even loss of life. And as we head into this afternoon, one of the things we wanted to do when we're in DC that we don't always get to do in our San Diego events or on the road is get the branches of government that can help us fix these things. So these are public-private partnerships. And as we pivot out of lunch, we're gonna start with presidential intent or executive intent with two members of the newest part of the White House called the Office of the National Cyber.
One of the newest now.
No
longer the newest.
One of the newest. Ooh. Goes fast. Second newest. One of the newest parts of the executive branch in the White House, the Office of the National Cyber Director. And without reviewing the entire schedule, you're also going to hear some CISA perspectives, which is the newest federal agency. You're going to hear some legislative branch perspectives, and then you're going to hear from HHS with some other talks in between. But to start our double feature of the White House, of the Office of the National Cyber Director, we're really pleased to have Seeyew here. When we met you, he was working for Senator Warner and drove an incredibly important paper called Cybersecurity is Patient Safety.
Woo-hoo.
And it really
in my
kind of put on the table.
Not wooing for
It put on the table, this is not just a HIPAA thing, or just a data thing. And now, leading one of the teams in Office of the National Cyber Director, and we'll introduce his colleague after him. So for the next 25 minutes or so.
Yeah.
Take it away.
Sure.
Welcome.
Well, nice to be here. I learned a lot from Josh and Bo and Kristen and Jeff about healthcare and cyber. So it's really great to be back here after a couple years of hiatus. Like he mentioned before, I'm here today to talk about cyber workforce. One of the most persistent challenges is a dire need of cyber workforce, right? The problem is clear. We just need more cyber talent, not just in federal government, but also in the private sector. But the solutions are pretty elusive so far. The number of open cyber jobs, approximately 500,000 nationwide. It's enormous, and the trend must improve. But with this challenge, I like to think about it as an opportunity. We have an abundance of talented individuals in this country who can do the work, but only if we can connect them to the work and explain to them how they can help the nation. It is truly one of those jobs that are with a purpose. No matter whether you work for the federal government or the private sector, doing the work in cyber, protecting healthcare systems, protecting water utilities, you are protecting our nation. So it's truly a job that is good paying, that's meaningful, and with a purpose. So how do we get there? Well, before we talk about it, let's talk about it from a healthcare standpoint, right? I always like to tell Josh every time I see him, I'm like, I don't know whether we should train healthcare folks to know cyber or train cyber folks to care about healthcare. I don't know. So if you have an answer, let me know. I'll stay here for a few minutes right after. Teach me, help me, and my team is here as well. But the thing about challenges in healthcare and in cyber workforce is that there are three challenges. First, most Americans don't see themselves to do cyber work. They think it's too technical. They still envision the guy in a hoodie sitting in the basement, hacking, defending, drinking Mountain Dew, right? But that's not the cyber worker that we have today. All of us here I consider a cyber worker. We care about protecting the system. It's more than just about losing data. It's about having a resilient system. How do we make sure the system can still work? How do we make sure the system can still save lives, right? So that's number one. That's the number one problem. The second problem is we don't have infrastructure to train people to do cyber work. What do we mean by that? Well, we need an infrastructure to train folks to do the traditional cybersecurity work, but we also need the infrastructure to train, business majors with some cyber skills. Healthcare, people who are in healthcare with some cyber skills, right? It has to be across the board. if someone who have been doing work for 20 years and in energy and they want to pivot to cyber, we don't have a pathway for them today. So that's the second problem. Finally, the third problem is there's a lack of sort of like an ecosystem of local partnerships, right, between employers, academia, local government, to make sure that we are training the people for the jobs that are available in their community. I don't know, I wouldn't know from Washington, D.C. what are the needs in Idaho, for example. And the needs from Tampa, Florida is very different from San Antonio. And this ecosystem can also be sector specific, doesn't have to be regional. Like for example, what I mentioned, right? Cyber workers in healthcare, could be a little bit different from a manufacturing plant. Maybe not for equipment, but for, let's just say, energy, right? So there's all these differences that unless people come together and work together and have formed partnerships and form a pipeline, we will continue to face this problem. So this is what the Biden-Harris administration has done. Our solution to this is we released the National Cyber Workforce Engineering Strategy to address these three challenges. First, we want to broaden the appeal of cyber workforce to all Americans, and then we want to make sure that we're removing barriers for them. So that's why just a couple months ago, we announced that we're removing four-year college degree requirement and pivot to skill-based hiring for 100,000 positions in the federal government. So we're leading by example. With that, thank you for the clap. I take that one. No, I think we have to lead by example when we are saying that hey, some of the best cyber security experts are musicians in philosophy major in my life. So we have to take a lead, an example, and that's what the federal government is doing. So first one is let's just broaden the appeal and make sure that we're removing barriers for folks to join in. The second is we are making sure that there are more training opportunities for folks. Things like registered apprenticeships, cyber clinics, right? Those are the things that I think is especially relevant to the healthcare industry, right? Perhaps having someone doing registered apprenticeship for cyber in a healthcare facility or medical equipment manufacturers, they can then learn very specific cyber needs for those equipments and for that environment. That can actually get people who might not consider an opportunity to do this work in healthcare to do this work. Same thing with the concept of cyber clinic, right? We have just like law clinics, we have students who come together, intermajors and interdisciplinary, right? They're trying to solve a problem. So perhaps one or two or multiple of those cyber clinics that we are starting in the country by federal funding as well as private sector funding can focus on helping meet the cyber talent needs in the healthcare and the medical equipment industry, right? So that's the second thing. The third thing is we're traveling all around the country to make sure that we're forming all these partnerships, right? When we were in San Antonio, for example, we worked with the University of San Antonio, Texas A&M, University of Texas A&M in San Antonio, to worked on a program for cyber in water utilities, right? So folks might have heard about some of these water utilities, potential problems that we have had, right? We have. So we need more cyber folks to work in water utilities. So that's what we are doing today. So I guess, what are some of the other progress that we have been doing, right? Department of Labor announced a lot of funding for registered apprenticeships in the past couple of months. So I highly encourage folks who are thinking about the cyber workforce angle for healthcare to think about whether a registered apprenticeship is a pathway to get some talent to doing this work. Okay? So with that, I just want to kind of give a quick overview of what we are doing, what we plan to do, and I would like to open it up to some questions.
I would like to start by thanking you for providing us all this good information and everything. I do have another question regarding the requirement for the cyber clinic and the other federal apprenticeship programs that the government is offering. I had some friends who are not U.S. citizens, who are just immigrants, that are eligible for any of the programs, any federal programs. How you doing with the barrier, removing the barrier of the citizenship requirement?
Oh, you mean they're not U.S. citizens and they don't
Yes.
qualify? You know, I would give you the standard answer here, right? We want all the talent that we can get, but sometimes we are sort of like constrained by the statute, like how those programs are being written in the statute. So we'll continue looking for opportunities to expand those opportunities for those who are not U.S. citizens yet. But right now, what sort of like what the program is what legally we can do.
Okay.
Go ahead.
I'm a loud person, I'm a nurse.
Yep.
So it's interesting to bridge this gap between healthcare and the cyber community.
Yep.
So I'm very new. I represent 2 different hospitals. I'm a registered nurse and I'm the president of a union. And one of our hospitals is just coming out of the weeds from this cyber attack.
Mm-hmm.
I'm still calling my 37-year-old kids to help me with my computer issues at night.
Yep.
But I reached out to the chief of this hospital, one of my board members, and I said, what would you say? What else can I add to my discussion? And she was like, we need more training.
Yep.
Hearing Nate say that someone opened an email on their laptop,
Yep.
you know, they sure didn't do that to be malicious, but that was one of the things she listed to me last night, that there's not enough training. People do things that don't seem like they would be malicious, and yet they are.
Right.
So I mean, I think
So-
we could do better with that, even initially.
So I feel like there are 2 parts, there are 2 answers to your questions, right? One of the things is, you know, the president released a national cybersecurity strategy last March, right? And one of the imperatives, and I should cover this because I just sort of jumped into the workforce part, I figured I'll leave the rest of the stuff to Steve. But the idea is that we expect people with resources to do more. So what that means is people who or organizations who build technology should do it in such a way that's resilient and not allow you to make those mistakes, right? So in some way, the solution shouldn't be like, I should go work with my mom and my dad to be like, do not click like you know, like I know we say that, but it has shown to be really, really difficult to do, right? Like I always like to say that mom, you shouldn't be on the front line against the People's Republic of China, you know, like this is one person against the whole country. So that shouldn't be the case, right? Which is why the strategy calls for like making long-term investments, pivoting to like building more resilient technology, right? Now, but after saying that, I also know that it will take a while.
Right.
It takes time, all right, and it takes investments, right? So in the meantime, what we are looking at is we are pushing for integrating cyber into a lot more disciplines, right? So when I talk about business, nursing, you know, so that's what we're working on. We have a grant that is ongoing right now from NSF and NSA to help educators integrate some of these cyber into the cyber elements into their curriculum, right? But that also takes time, but hopefully a little shorter. But in terms of you know, current employees, right? Current employees, you know, I think has to start from the very top, right? Like I don't get the sense of like administrators or CEOs understand even like the cyber risk just yet. People don't see cyber risk as one of the business risks that they have. I think they're just starting to. You know, I spoke to a floor manufacturers, right, who was hacked and they had to pay a ransom and that kind of stuff. So I think the moment it's a problem, it's not a real problem until you get hit, unfortunately. So I don't have a good answer for you on how to train people to not click links because it just hasn't been proven to work.
So without speaking for the White House, as we pivot to the next question, I think one of the reasons we made CyberMed Summit was we wanted not just IT people doing a tabletop crisis simulation, we wanted clinicians and hospital administrators and state and local government. So the degree to which, in real time, I suppose we could encourage existing crisis simulations or sector exercises could deliberately include clinical staff or non-cyber
Yes.
staff.
For sure.
I think that was also in the,
I worked at universities for many years. One place you can get some things is, have you ever considered talking to the local university's marketing department and computer science department, saying, can you come up with a one-pager that I can hand off to my staff that gives them those tips that they need to remember to look at for cyber? At least it's a stopgap until these trainings are in place. And that could be utilized. Every university, a lot of them are moving toward capstone projects.
Yep.
And if you have to talk to the university professors at least a semester ahead of time, but they want some real life stuff, so the students will walk out with the experience of a real world incident or something and can have it on their resume, so it's a win-win for everybody.
And the capstone project is sort of like a variation of the cyber clinic model, right? In which someone from the local community can go to university to get some help. So in this case, you articulate and you sort of say like, hey, I need some information, right? For my staff.
All right, I think we have time for maybe 2 more.
Okay.
What's up, Josh? Oh, here it goes.
Oh, you first?
Slightly facetious question. I heard the FBI is having, or maybe it was the CIA, one of those, having trouble attracting talent because they don't relax their drug testing requirements. What do you guys think about that?
Ooh. That's a great question. I should say that there's a pending update on a form in which questions will be asked very differently. And it's something along the lines of like, have you done drugs that is illegal in 50 states? So some aren't. So so there will be some updates that are upcoming. There will be some changes that we're working on right now.
Hello, good afternoon. My name is Toma Taylor Nakundu. I am a security consultant, and I do know that the NSA does have for cybersecurity does offer cybersecurity services for contractors. And so I was wondering if there were maybe along the lines of what the lady suggested about current employees. Do you foresee maybe in the future expanding those services to maybe cybersecurity awareness training on top of the technical services you provide, such as DNS protection and security assessments? Thank you.
Yeah, this one is a tough one, right? I think a lot of times when you think about awareness, very similar to cyber workforce jobs is that you have all these like cyber jobs sort of like in every single industry right now, in retail, in manufacturing, and healthcare. I think for awareness, we ought to be meeting people where they're at. And I think sometimes the messenger probably shouldn't be someone who's like more about cybersecurity, like shouldn't be someone who's like hardcore national security and like all this other stuff, right? So one of the things that, the reason why we're pushing for these sort of like local ecosystem partnerships is because we thought that the people who are locally can communicate better for cybersecurity awareness, right? So just like how we have seen schools who would do career nights for parents. So like in a lot of like Hispanic Latino schools, like because there's language barrier and whatever, so there are school districts in the country that does a career fair for Spanish-speaking parents. And then they will come and they will learn about like Korean cyber, they'll learn about what cyber is, they'll learn about some of these cyber tips, because the school has a relationship in that community to deliver that message, right? So it's not a big national program like that we are running, but we thought that for things like this, it's better to be done locally, so that it's not the federal government is telling us this, we don't want to do it, So there's always that angle as well in a local context.
Along the lines of the training you mentioned earlier, has there been any discussion around opening up cyber positions that are posted or you're going to be hiring for more Schedule A type applicants? So the people who, I happen to fall under Schedule A, and I know a lot of people who do, or on Medicaid or Medicare, and like trying to tap into that workforce a bit more.
Yes, I'm glad that you brought that up, right? So we talk about like broadening the pipeline. I would say some of the work that will be announced soon is one of the departments or agency is launching a program to make sure that neurodivergent individuals can do cyber work in the federal government. And then if they successfully matriculate through the program, they'll be hired through Schedule A, right? So the thing is, a lot of this stuff, we want to do it in a, measured way, so that, you know, as much as we need the talent now, we also need to make sure that we're doing right by the candidates and the job seekers. So if there's any accommodations or whatever that we want to do for folks who are coming in through Schedule A, or other types of, you know, different types of Schedule A purposes, we want to make sure that they can come in and be successful.
Okay.
Okay.
I want to, since I thought we had enough time for one more, I'm gonna squeeze one in.
I have more stuff to talk about.
Oh, you
I actually
got
have more
one.
stuff
If
to
people
talk
are
about.
interested in the jobs, where do they go to look?
Okay, you want to say that again?
If people, I know people who would be interested in jobs like this, where can they go to look?
So for the government, it's cybercareers.gov, right? If you want to track our work, you can go to whitehouse.gov/cybercareers or cyber workforce, either one would work. One of the things that we like to do is we like to highlight good best practices that other people can learn from, and you can kind of see some of the best practices of some of the organizations or universities have done, right? We even highlight the idea, you know, like a small consulting firm who wants to hire 5 people from a school just to show them as a paid intern, just so that they can get some of these hands-on learning going, right? So check out the website. I think it's not a question. I mean, I have other stuff to talk about too, if you guys don't have any questions. I just sort of cut short my speech because I spoke to Josh. Josh said, hey, we want to know about this. I'm like, okay, fine.
I really want to riff off something you said about the difference between skills-based and education. Now, I myself have a master's and I'm ABD on a PhD, but I hire people who don't have degrees because they have skills, and I don't need a degree, I need the skill.
Right.
We bring in interns from Reg Affairs to do cybersecurity for medical devices because I want them cross-trained. And I want them, as Reg Affairs people, to be asking the R&D teams at the medical device manufacturers they go work for next to say, hey, where's the cyber stuff? Give me the cyber stuff. Here's a list of things that I know you gotta have. Where is it
Yeah.
now? You need the cross-training. You need to get some of the clinicians out there who have at least a baseline technical interest to start buying in, and then training their teams below them. And sometimes you need to take people who are really technically savvy, probably me, and find people who can speak in plain language and take the technical jargon out of it so that we can have a conversation about impact and then talk about how to stop the impact.
Right. I think that's a really good point. Like when we talk about skill-based, it's not necessarily a ding on college degrees or masters or whatever, because we do need those folks who have gone through those rigorous programs, right? It telegraphs something when you kind of have degrees or masters or PhDs. What we're really focusing on is, because the technology is changing so fast, it's faster than I can actually train people, we should be focusing on skills and the ability to learn skills as a way to hire and retain and train folks. Doing so, having a skill-based approach, by the way, future-proof the workforce, right? Because when your workforce is dynamic, when your workforce have the skills to learn, no matter what disruptions, right? It's AI today, it will be quantum in the future. The workforce will be resilient and meet those demands and challenges of the future, because then they can learn those new skills and adapt. That's what we want to do, instead of just filling butts on seats, and then a few years later, they don't have a position anymore because it's, you know, it got automated or whatever.
I'm gonna call an audible just because
Yep.
I feel like you and your team are probably the best poised to help the room for this. I felt very of two minds last week. Senator Wyden wrote a pretty aggressive letter against, it's maybe 2-3 weeks ago now. He was referring United Health Group and Change Healthcare to the FTC and SEC for investigation, and one of the items they called out was that the CISO had never been a CISO before, and with such an awesome responsibility for a publicly traded company, critical infrastructure. And on the one hand, I said to myself, yeah, this is a systemically important entity, it's critically important, of course, you need our top talent to fill these critically important national security roles. On the other hand, I know we don't have enough CISOs,
Right.
and many CISOs for the next 5 to 10 years will be learning on the job.
Yep.
So did your program look at prioritizing with scarce talent pool of currently qualified, how they might be encouraged or deployed, and also the grace to have graduated expectations as we ramp people up?
So I'm not gonna go against Senator Wyden, right?
Right.
Like that's not the point here. But what I would say, yeah, Steve, come on. So what I would say is this, right? Is that when we look at the problem of cyber workforce, you see a lot of problems everywhere. Okay, you see problems in like leaderships not understanding the risk of cyber. You see middle managers issues with cyber and lack of cyber skills, and you see lack of opportunities for some of the early career folks to get into cyber because of degree requirements, right? Essentially what the position that we're taking in terms of implementation is that we can solve all at once. And what we've realized is the early career people today will be the future leaders, right? So we have taken the bet of just trying to make sure that more people can be part of the cyber careers right now. So a lot of the focus is not about just like getting 5 more CISOs, it's about like, let's just get 1,000 more people interested in cyber career. I'm betting some of them will be really good CISOs in the future. Is sort of like the focus that we have taken. I think there's one more question, or not? Okay, so with that, I think I'm just gonna close out, right? Is that, you know, we just need more Americans to join cyber workforce so that all Americans can benefit from the cyberspace. And then I think until we kind of have that understanding, it's really hard, you know, for us to kind of move forward, right? So my hope is, as you think about, you know, after my talk today, as you think about how we talk to folks, I think one of the ways that I encourage folks to think about is how do we demystify cyber careers, cyber roles, to make sure that it's more accessible to all folks from all sectors and all majors. Not all jobs require the hardest technical skills. Some of them do, I'm not denying that, and we need some of those people, but there's also, we need a lot of people who are like maintaining the HVAC that is now digitized, right? Or, you know, people who are designing medical equipments right now, they might not have cyber in mind, you know? So you can kind of like, you gotta have to think through how this permeates everything. If you don't do that, then we're gonna have a rough road ahead of us. All right, I'm gonna invite Steve to come up. Go ahead. Thank you.